Begin by considering the scapula. If we look at its position on an articulated skeleton, we can determine its anatomical position. When looking at each bone, it's helpful to determine its position at the articulated skeleton. Looking at a disarticulated scapula, we are able to note its two surfaces. The anterior surface lies on the ribs and is called the costal surface. The surface that faces dorsally is called the dorsal surface. The costal surface presents a large concavity called the subscapular fossa. The dorsal surface of the scapula is separated by a transverse ridge called the spine. The spine separates the dorsal surface into two fossae, the supraspinous fossa superiorly and the infraspinous fossa inferiorly. Follow the spine laterally to note the flat process called the acromion. This process protects the shoulder joint and is somewhat subcutaneous, and thus can be felt or palpated on yourself at the top of your shoulder. This bone appears triangular in shape, and thus there are three borders. Note that the border which parallels the vertebral column is the medial border or vertebral border. The horizontal upper border is called the superior border. The border which is inferior and lateral is called the lateral border or axillary border. Follow the superior border to a prominence which resembles the beak of a crow. This is called the coracoid process. Keep in mind that the word coracoid means crow's beak. Since there are three borders, we will also see three angles. The superior angle is at the junction of the superior and medial borders. The inferior angle is at the junction of the medial and lateral borders. The lateral angle is at the junction of the superior and lateral borders and presents a smooth concave area called the glenoid cavity or fossa. In this cavity is found the head of the humerus forming the shoulder joint. Just above the glenoid cavity is a small projection called the supraglenoid tubercle, and just below the glenoid cavity is a small roughened projection of the upper part of the lateral border called the infraglenoid tubercle. The next bone is the clavicle. The bone has a double curve so that its profile is like an elongated S. The medial 2/3 of the clavicle is convex forward, whereas the lateral 1/3 is concave forward. There are two ends or extremities to the clavicle. The end which connects with the sternum is called the sternal extremity and is somewhat round. The opposite end is the acromial extremity and is somewhat flat. It articulates with the acromion of the scapula. Next, study the upper half of the humerus. Note that the round end is superior and the end with the smaller knuckle-like projection is inferior. The superior part presents a very smooth head which articulates with the glenoid cavity. Bordering this head is the anatomical neck. The greater tubercle lies at the upper lateral margin of the bone. Directly anterolateral to the head lies the lesser tubercle. It is slightly inferior to the greater tubercle. Each of these tubercles has a crest, which is a ridge of bone directed inferiorly a slight distance from each tubercle. Between the tubercles and their crests is a well-marked groove called the intertubercular groove. This may also be called the intertubercular sulcus or bicipital groove. Directly below the tubercles and the head is the surgical neck. The name is significant due to the frequency of fractures at this level. On the lateral surface of the humerus at its mid-level lies a roughened area called the deltoid tuberosity. At the distal end of the humerus, note the smooth, rounded surfaces are for the articulation with the radius and ulna. The surface that is shaped like a spool is called the trochlea, and this is the structure that articulates with the ulna. Just lateral to the trochlea is another smooth condyle-like surface called the capitulum, which is a structure that articulates with the head of the radius. The process extending laterally from the capitulum is the lateral epicondyle. The process extending medially from the trochlea is the medial epicondyle. The ridges of bone that run proximally from the epicondyles are called the medial supracondylar ridge and the lateral supracondylar ridge. The anterior distal surface of the humerus exhibits two fossae. Medially, we see the coronoid fossa, which contains the coronoid process of the ulna during flexion of the forearm. Just lateral to this is the radial fossa, which receives the head of the radius during forearm flexion. Turn the bone over and look at its distal posterior aspect. The depression found here is the olecranon fossa, which contains the olecranon process of the ulna during extension of the forearm. The ulna is a long bone having a proximal and distal extremity and a shaft. The proximal extremity presents a very prominent semicircular notch called the trochlear notch. Within this notch rides the trochlea of the humerus. The olecranon process is the upper end part of this bone, extending back from the upper lip of the trochlear notch. The lower lip of the trochlear notch is the coronoid process. The roughened lower part of this area is called the tuberosity. On the articulated skeleton, determine that in flexion of the forearm, the coronoid process of the ulna enters the coronoid fossa of the humerus, and that during extension of the forearm, the olecranon process of the ulna enters the olecranon fossa of the humerus. The fossa on the lateral side of the proximal part of the bone, just lateral to the coronoid process, is called the radial notch of the ulna. It articulates with the circular head of the radius. Distally, it presents a conical styloid process on the medial and posterior side. This entire extremity is termed the head of the ulna, which we can see on ourselves as well. Here we see the radius. Of the two bones in the forearm, the radius is the one that moves in pronation and supination. The proximal end presents a circular head, which appears as a thick disc. The head articulates with the radial notch of the ulna. Below the head is the constricted neck. Distal to that, the tuberosity of the radius is an oval roughened area on the medial side of the bone about an inch inferior to the head. At the distal end of the radius, find the styloid process on the lateral side. On the medial side is a depression for the articulation with the distal end of the ulna, and this is called the ulnar notch. The inferior surface of the bone is concave for articulation with the carpal bones and is called the carpal articular surface. The bones of the wrist are called the carpal bones. Keep in mind that carpus is Latin for the word wrist. There are 8 carpal bones, and all of them are small bones, held together tightly by ligaments and arranged in two rows, a proximal row and a distal row. The bones of the distal row from lateral to medial are the trapezium, trapezoid, capitate, and hamate. The trapezium is closest to the thumb and can be remembered since trapezium rhymes with the thumb. The proximal row from medial to lateral is pisiform, triangular or triquetrum, lunate, and scaphoid. Try to remember the carpal bones. Some, lovers, try, positions, that they can't handle. The metacarpal bones are found just distal to the carpal bones. There are 5 in total, and each is a small long bone with a shaft, head, and base. The head is the distal extremity, and the base is the proximal extremity. The phalanges are the bones of the fingers and number 14. There are 3 in each finger, except for the thumb, which has only 2. In the fingers, the phalanges are named by their location, the proximal most being the proximal phalanx and the distal most being the distal phalanx. In the 2nd through 5th fingers, the intermediate phalanx is called the middle phalanx.